How to provide oral care. First, position the patient. Place the patient in a reclined or side-lying position with their head turned to the side and toward the mattress. Raise the head of the bed to at least 30 degrees if possible. Next, protect the patient. Place a towel or waterproof pad under their chin and cheek. Then, prepare your supplies. Use a sponge-tipped oral swab. A soft toothbrush can also be used instead. The next step is to clean the patient's mouth. Use a soft toothbrush or sponge-tipped oral swab to gently clean the patient's teeth, gums, and the roof of their mouth. Next, rinse the patient's mouth. Use a slightly wet, clean swab to rinse the patient's mouth. Then, moisturize the patient's lips. Use a gloved finger or sponge to apply a thin layer of water-soluble moisturizer to the patient's lips. Finally, finish the procedure by returning the patient to a comfortable and safe position. Northern Illinois Hospice, first in caring for life's final months.